Is RAD related to autism? Have you ever wondered how reactive attachment disorder relates to autism spectrum disorder? It's a question that many parents and caregivers ask, especially when they notice overlapping behaviors in children. Let's break it down together. Reactive attachment disorder, often referred to as RAD, is a condition that arises from severe neglect or abuse during early childhood. This can lead to difficulties in forming healthy emotional attachments with caregivers. On the other hand, Autism Spectrum Disorder, known as ASD, is a neurodevelopmental condition. It is characterized by ongoing challenges in social communication and includes behaviors that are restricted and repetitive. While RAD and ASD are different, they can share some similar symptoms, making it tricky to tell them apart. For instance, both conditions can involve unusual social responsiveness and challenges with emotional expression. A child with RAD might show limited emotional responses or struggle to seek comfort, while a child with autism may find it hard to understand social cues or initiate interactions. Interestingly, some behaviors seen in RAD can resemble those of autism. A child with RAD might withdraw socially or engage in repetitive actions. However, these behaviors in RAD often improve when the child is placed in a nurturing and supportive environment. In contrast, the behaviors associated with autism are usually more persistent and do not change as easily with different surroundings. When it comes to communication, children with autism often face significant language delays or have atypical communication styles. In contrast, children with RAD usually have age-appropriate language skills, even if they struggle emotionally. Repetitive behaviors in autism are often self-soothing, while in RAD, they may arise from anxiety or fear. Research indicates that some children with RAD may score high on tests for autism-related social difficulties. Conversely, many children with autism might show attachment issues, suggesting that these two conditions can sometimes occur together or mimic one another. It is also important to note that attachment styles can influence how autism presents itself. Secure attachments can lead to better social and language outcomes for children with autism, while insecure attachments might worsen their social challenges. However, unlike RAD, autism is not caused by attachment issues or neglect. To differentiate between RAD and autism, a careful clinical assessment is necessary. This often involves observing the child in various settings and considering their developmental history. Understanding these differences is essential for guiding appropriate interventions. RAD treatment focuses on creating stable and responsive caregiving environments to build secure attachments. In contrast, autism interventions emphasize communication skills, social abilities, and managing repetitive behaviors. In summary, while reactive attachment disorder and autism spectrum disorder can share some social and behavioral traits and may even co-occur, they are fundamentally different conditions with distinct causes and developmental pathways.